Hey everyone, for discussion post 5, I'm going to be talking about my Peacock question that I chose and how to conduct a research on it. So for my Peacock question, for population, I picked emergency department nurses. For my intervention is how does implementing training and de-escalation skills improve workplace violence between the nurses and patients. My comparison is going to be to doing no training or de-escalation skills. The outcome will both include quantitative and qualitative research on frequency rate if the training improved workplace violence and de-escalation on patients, or and the qualitative and how the nurses felt about it, and the safety, confidence, and preparedness that they felt coming into the situation. And then time over 6 months to a year. I feel like 6 months is kind of cutting it just a little bit short, but maybe it would be enough time if the skills seem to be working and the training is working well. Typically, I think that the quantitative and qualitative is important to any research that you're conducting because it's going to show the complete understanding of whatever research question, the hows and the whys of what you're doing and what you're researching and why it's important. So let me figure out how to share my screen here. Okay, so I think that that's working. So for my start, I normally pick the EBCOS off of the school site for the library, and I kind of just look, well, I can't click on it. Let's get this way. Um, I try to pick that one first and see what it has to offer. And unfortunately, I feel like it doesn't always have everything that I need. So sometimes I'll go and just use Google, and then sometimes I will use UpToDate, but it's hard to cite that. So you can sometimes gather information though that you need, just kind of little bits and pieces of what you're looking for. The database. Coast. This is the one that I'm most familiar with just because it's the one that we were trained at the beginning of the program to use. Okay. So typically I'll click the peer reviewed and then within the 5 months. And for this, I would just type in workplace violence, care or nursing, and just kind of see what they have to offer. Of course, it says peer reviewed right here. And then I normally just kind of scroll through and read the titles. And no, it's always good here because you know that they're all accredited. And then, so let's just say I'll click on this one. I always just go through quickly and kind of scan at what everything includes, and a lot of them are kind of shorter, so you can just read the abstract really quick and know exactly what you're getting, the results, what type of research it was, and then it's always easy to download it to your computer if you want to keep it that way. So to narrow it down, loading, I normally just kind of skim and decide how. A lot of them are from like different countries, so I try to avoid those the best that I can. And then some of them are not always real, like if I'm looking for emergency department things, it's not always related, but it might be related to some type of hospital. Um, That's typically what I do. And then I go through and just read. And of course, it takes a little bit of time. And I will post all of the results in my reference page of the ones I picked. I'm going to try to focus on how it improves a quantitative and qualitative research and the results of it, and then what type of training the facility offered. If there was more beneficial training or a specific study that they followed that helped improve the overall satisfaction of the patients, of course, and the nurses. Thank you.